Take your hands off that patient. Specialist Tyler Brooks struck the blue gloves from Walter Hayes's fingers. The gloves slid across the polished floor of Fort Hamilton Military Hospital and stopped beneath a recovery cart. The sound was small. Every nurse at the station heard it. Walter did not look down. He stood beside his gray Environmental Services card, one weathered hand resting on the recovery room doorframe. His pale blue eyes remained fixed through the glass at Sergeant First Class Daniel Price. Daniel had returned from a routine procedure 20 minutes earlier. His monitor showed numbers that did not yet look dangerous. A thin blanket covered him from the waist down. His head rested nearly flat against the pillow. To Tyler, the patient appeared tired. To Walter, something had changed. The muscles along the left side of Daniel's neck had tightened. His chest rose shallowly. Between one breath and the next came a dry interruption, faint enough to disappear beneath the ventilation system and the squeak of rubber saws in the corridor. Walter tilted his head, raised the bed. Tyler stepped between him and the door. "Mr. Hayes, you clean this wing. You do not treat patients." Walter listened through the glass. Daniel took another breath. "Shorter. Do not leave him flat." Tyler looked toward the clock above the nurse's station. General Robert Callahan was expected for an inspection in less than 20 minutes. Every cabinet had been checked. Every clipboard had been aligned. The recovery wing was supposed to demonstrate efficiency. Walter, in his faded gray shirt, stood in the middle of the corridor like a problem no checklist had anticipated. "General Callahan is arriving," Tyler said. "The hallway needs to remain clear." Walter's fingers tightened against the metal frame. "The patient needs to breathe." A young nurse named Emily Carter looked through the window. Daniel's monitor continued its steady pattern. "I do not see anything," she said. Walter did not blame her. "You will." Tyler gave a short, humorless laugh. "And you know that from standing behind a mop bucket?" Walter's eyes moved to the nurse. "Raise the head of the bed 10 degrees. Then call Captain Mitchell." Tyler pushed the door closed. The latch clicked between Walter and the patient. "Stay out." For 1 second, Walter stared at his own reflection in the glass. His hair was white. His shoulders had lowered with age. Pale scars crossed the backs of both hands. The left index finger bent inward at the middle joint. Beyond the reflection, Daniel's fingers moved beneath the blanket. A warning tone sounded. Not loud. Not yet. Emily looked toward the monitor. Daniel's oxygen level had begun to fall. Tyler's confident expression weakened. A second alarm joined the first. Inside the room, Emily raised the head of the bed. Daniel drew one strained breath. Walter closed his eyes. The sound reached through 47 years. Rain against canvas. A field radio breaking apart beneath static. A young lieutenant trying not to admit he was afraid. Walter opened his eyes. "Call Captain Mitchell now." This time, Emily obeyed. Captain Lauren Mitchell arrived at a run. She entered the room, examined Daniel, and ordered oxygen increased. Another nurse checked his pressure. The numbers had begun to fall. Tyler followed Mitchell inside. Walter remained outside the glass. He bent down, recovered the gloves from beneath the cart, and placed them neatly on the top shelf. He had worked at Fort Hamilton for 6 years. Most employees knew him only as Mr. Hayes, the quiet maintenance worker who arrived before dawn. He cleaned patient rooms, checked wheelchair brakes, dried the floor near rehabilitation before the first prosthetic appointments began. Every morning, he polished the hospital's memorial wall one name at a time. When nurses asked whether he had served, Walter always gave the same answer. A long time ago, his personnel record offered little more. Walter Hayes, 78 years old, Environmental Services, authorized for restricted medical wings by administrative exception. The final line had puzzled several supervisors. Background record subject to military district clearance. Tyler once joked that the paperwork was probably older than Walter. Inside the recovery room, Mitchell listened to Daniel's lungs. The oxygen level continued to drop. His chest sounded clearer than she expected. She looked at the old procedural scar near his left collarbone, then at the swelling beginning beneath it. Walter stood outside the glass with 2 fingers resting against his own wrist. He counted. 1 breath. Pause. A second breath. Longer pause. Mitchell noticed the movement. It was precise, not the nervous tapping of a janitor waiting to return to work. Walter was measuring a pattern. Tyler drew the privacy curtain halfway across the window. Walter disappeared behind the fabric. "We should call security," Tyler said. He attempted to enter a restricted patient room. Mitchell did not answer. She reviewed Daniel's chart. 6 months earlier, he had suffered a fragment injury near the left collarbone during deployment. Imaging had shown the fragment in a stable position. Surgeons had decided removal carried more risk than leaving it in place. Mitchell read the note twice. What did Mr. Hayes say? Tyler frowned. That the patient should not be flat. Anything else? He said something was pressing where it should not. Mitchell looked again at Daniel's neck. The swelling on the left had grown slightly. She ordered portable imaging. Tyler glanced at the wall clock. Captain, General Callahan's team will be here any minute. Mitchell turned toward him. Then they will see a hospital treating a patient. The answer ended the discussion. Beyond the curtain, Walter heard the order. He also heard Daniel take another thin breath. The sound opened another door in his memory. A canvas field station shuddering beneath a storm. A young lieutenant whispering that he could not feel his left hand. A medic at the radio reporting that evacuation was delayed. 40 minutes. Walter had looked at the failing light, the injured men, and the rain gathering beneath the tent walls. Then we make 40 minutes. The memory vanished. Walter looked at the privacy curtain. He had spent years learning how to become invisible. Invisible men were rarely asked questions. They were also rarely stopped from listening. He heard Mitchell request a new blood pressure. He heard a nurse say the swelling had increased. He heard Tyler insist that the earlier imaging had been clear. Then he heard Daniel's breath break. Walter moved. He pushed the curtain aside and entered the room. Tyler turned sharply. I told you to stay out. Walter stopped outside the marked clinical area. He did not touch Daniel. Support the left shoulder. Do not press directly on the swelling. Tyler stepped toward him. You are not authorized to give instructions. Walter looked at Mitchell. Captain, the old fragment may have shifted after positioning. The swelling is affecting something near the collarbone. Mitchell watched Daniel's face. What makes you think that? The breath changes when his shoulder settles back. She looked at the monitor. Walter continued. Raise him slightly more and support beneath the shoulder. If the breathing improves, scan the area before moving him again. Tyler shook his head. He read one line in the chart. Walter glanced toward the chart on the counter. A faint pencil mark sat beside the note about the fragment. Tyler saw it. You marked his medical record? I marked the line people were skipping. You had no right. The mark can be erased. Walter looked at Daniel. Lost time cannot. Tyler's face tightened. Security officers appeared in the corridor outside. Walter did not move. Mitchell nodded to Emily. Support the shoulder. Emily placed folded support beneath Daniel's left side, without pressing the swelling. Daniel's breathing eased by a small, but visible degree. The monitor did not return to normal, but the downward trend slowed. Mitchell looked toward Walter. What else? Tyler stared at her. Captain. Mitchell kept her eyes on Walter. What else are you seeing? Walter stepped closer to the boundary line. The swelling is not only superficial. His neck is tightening when the shoulder drops. Keep him upright. Do not move the left side until imaging confirms the position. Mitchell gave the orders. This time, no one argued. Tyler stood near the door, watching the authority shift away from him. It did not pass to Walter. It returned to the evidence. That made the loss harder for him to accept. You are making guesses, Tyler said. Walter looked at him. All medicine begins with noticing what changed. Tyler reached for Walter's wrist. The movement was not violent, but it was public. He lifted Walter's scarred left hand beneath the fluorescent light. These hands shake when he carries a cup. The room became still. These hands clean floors. They empty waste bins. Tyler turned Walter's palm toward the staff. The bent index finger, white scar, and calloused thumb were fully visible. These hands belong on a mop. Walter looked down at his own hand. For an instant, the recovery room disappeared. Rain hammered canvas. A support frame shifted above a treatment table. Walter caught it with his left hand before it struck the young lieutenant beneath him. Pain tore through the finger. The joint bent. Someone shouted for him to switch out. Walter tightened his right hand around the clamp. No one gets left behind while my hands still work. The memory passed. Walter gently pulled his wrist free. He did not answer Tyler. A nurse did. Captain, imaging is here. The portable unit entered. Mitchell positioned the team and reviewed the new scan. A shadow appeared near the old fragment. She enlarged the image. The metal had shifted. The surrounding tissue had swollen enough to affect the nearby structures. Mitchell's posture changed. Call vascular surgery. Prepare him for monitored transfer. Emily looked toward Walter. You were right. Walter shook his head. The scan was right. Mitchell began issuing orders. Daniel's breathing steadied as the team maintained his position. The immediate danger had not passed, but it had been identified. Walter stepped backward. His part was finished. Tyler stood near the door. His face had lost color. Two security officers remained in the hallway, uncertain whether they were still needed. Footsteps approached from the far end of the recovery wing. Military shoes. Several pairs. Measured. The inspection party had arrived early. General Robert Callahan walked at the center of the group. 3 stars rested on each shoulder. The hospital commander moved beside him, explaining recovery statistics and patient satisfaction targets. Callahan's attention shifted toward the alarms. What is happening? Tyler stepped into the corridor and straightened. General Callahan, sir. A patient developed a complication. Captain Mitchell has it under control. Callahan looked toward the crowded doorway. Why is security here? Tyler hesitated. A maintenance employee entered the treatment area without authorization. Callahan's gaze moved past him. Walter stood beside the instrument tray, preparing to leave. A nurse turned too quickly and brushed the tray with her sleeve. A metal clamp slipped from the edge. Walter caught it before it struck the floor. His hand moved once. No wasted motion. Thumb set along the handle. First 2 fingers balancing the weight. Wrist aligned. The exact grip of a man who had held metal steady while everything around him moved. Callahan stopped walking. The hospital commander continued for 2 steps before noticing. Callahan stared at Walter's hand, then at the bent index finger, then at the pale scar crossing the palm. The corridor noise receded around him. Rain. Canvas. A failing field lamp. A medic leaning over him and saying, "Stay with me. You have not been given permission to quit." Callahan's face changed. Who is that man? Tyler answered quickly. Walter Hayes, sir. Night maintenance. Callahan did not look at him. What name? Walter Hayes. The general stepped through the cluster of uniforms. Walter heard his name and turned. Their eyes met. 47 years narrowed to the distance between them. Callahan stopped several feet away. Doc. Walter still held the clamp. His gray shirt was creased at the elbows. A damp mark from the mop handle ran across one sleeve. He looked at the 3 stars, then at the face beneath them. Robert. The name left Walter quietly. Callahan removed his cap. He walked closer. The room washed without understanding. Tyler looked toward the hospital commander, waiting for someone to explain why a lieutenant general had addressed a maintenance worker as Doc. Callahan stopped in front of Walter. Let me see your hand. Walter hesitated. Then he opened his left palm. Callahan did not grab it. He supported the wrist gently. His eyes followed the scar. Still hurts before rain? Walter's mouth shifted slightly. Only before a storm. Callahan closed his eyes. When he opened them, the years of rank remained on his uniform, but not in his face. You remembered, Walter said. Every morning since. Captain Mitchell understood the meaning before Tyler did. Callahan was not greeting an acquaintance. He was standing before the reason he had survived long enough to earn 3 stars. Tyler stepped forward. Sir, there may be some confusion. Mr. Hayes is employed by Environmental Services. Callahan released Walter's wrist. I know what he does today. Tyler swallowed. He entered a restricted room. Callahan looked toward Mitchell. What happened after he entered? Mitchell answered plainly. He identified a change in Sergeant Price's breathing and connected it to a previous fragment injury. Imaging confirmed displacement and swelling. His warning changed how we positioned the patient and prevented further deterioration. Callahan looked back at Walter. Of course it did. Walter placed the clamp on the tray. The captain made the decisions. You always gave away the credit. Someone had to give it to the people doing the work. Callahan looked at the bent finger again. The corridor faded. He was 21. A newly commissioned lieutenant lying beneath a field blanket while rain hit the aid station roof hard enough to drown out parts of the radio. Evacuation delayed. 40 minutes. His left arm had gone numb. Each breath felt smaller. Walter Hayes, not yet 30, knelt beside him with his sleeves rolled above the elbows. Help the others, Callahan whispered. Walter did not look away. You are one of the others. A support brace shifted when the wind struck the tent. Walter caught it with his left hand. The finger bent. Pain crossed his face. His right hand remained steady. Another medic tried to replace him. Walter refused. No one gets left behind while my hands still work. Callahan's eyes had begun to close. Walter leaned nearer. Stay with me. I am tired. You have not been given permission to quit. Walter asked him about Ohio, Lake Erie in winter, his mother's kitchen, the letter in his pocket. The questions felt pointless until Callahan understood their purpose. Walter was building a road home one memory at a time. The evacuation team arrived after dawn. Walter stood only when another medic took his position. His hand had swollen badly. Blood darkened the cloth around his thumb. He wrapped it and moved to the next patient. There was no ceremony, no salute. No one read his name. The memory released Callahan. Fort Hamilton returned. Walter stood before him with the same scars, older but unchanged where it mattered. Callahan faced the room. This man kept me alive through the longest night of my life. No one moved. He kept 19 men alive in that field station. Walter looked toward the memorial wall beyond the corridor. There were 20. Callahan followed his gaze. One engraved name caught the light. Medic First Class Samuel Ward. The only man from the field station who had not survived the night. Callahan understood. Walter had polished that name every morning for 6 years. The general straightened. His heels came together. Walter shook his head once. Robert. Callahan raised his right hand. This is not for 19 men. Walter's jaw tightened. It is for the man who remembered all 20. The salute held. No one else copied it. Captain Mitchell stood at attention. Emily lowered her eyes. The security officers remained still. Tyler looked at Walter's hands. The same hands he had said belonged on a mop. Walter did not immediately respond. His left hand trembled at his side. The crisis was over. The room was quiet. The memories had returned. Then Walter raised his right hand. The salute was slower than Callahan's. Less sharp, shaped by age, but exact. Callahan lowered his hand after Walter did. No one applauded. The quiet carried more weight. A transport team entered to move Daniel Price toward surgery. Walter looked at the patient. He is the one who matters today. Callahan nodded. And because you listened, he still has today. Daniel was moved into the corridor. His eyes opened briefly as the gurney passed Walter. He did not know the old man. Not yet. Walter stepped aside. The red alarm above the room went dark. The corridor began breathing again. Tyler remained near the wall. His posture was straight, but the confidence had left it. He looked at the blue gloves Walter had recovered from the floor and placed neatly on the cart. Then at Walter. Mr. Hayes. Walter rested both hands on the cart handle. The tremor had returned. Tyler swallowed. I thought I was protecting the patient. Protecting a patient is honorable. What I did was not. Walter waited. Tyler looked toward the scars. I used your job title to decide whether your warning mattered. Yes. I was wrong. Walter's expression did not soften. It did not harden either. What will you do differently? Tyler had expected forgiveness. The question demanded more. I will listen before I dismiss someone. Walter nodded toward the memorial wall. Start there. Tyler looked confused. Walter removed a folded cloth from the cart and placed it in his hand. The wall begins at the top. Tyler looked toward the rows of engraved names. What am I supposed to do? Read each name before you clean it. Callahan watched him. You do not skip one, Walter added. Tyler closed his fingers around the cloth. Yes, sir. Walter looked at him. I am not your sir. Tyler glanced at the gray shirt. Then at Callahan. No, he corrected himself. Yes, Mr. Hayes. Captain Mitchell returned from the elevator. Sergeant Price is with the surgical team. They believe the complication was identified in time. Walter's shoulders lowered. His family. On the way. Good. Mitchell looked at him. How did you hear it? Walter glanced toward the now empty room. The body changes before the monitor understands why. That is not what I meant. Walter waited. She pointed gently toward his ear. How did you learn to listen like that? Callahan answered. In places where the machines did not always work. Walter looked at him. That was a long time ago. Callahan shook his head. Not to your hands. The hospital commander approached. For 6 years, he had passed Walter in hallways and never asked a question beyond whether a floor would be dry before morning rounds. Mr. Hayes, I owe you an apology. Walter looked toward the patient rooms. You owe them attention. The commander accepted the correction. Then help us understand what we are missing. Walter rested one hand on the cart. I am not a consultant. No, Callahan looked down the corridor. You are the man who walks this hospital when everyone important has gone home. Walter's eyes narrowed slightly. Callahan continued. Tell us what the building looks like at night. Walter sighed. It was the closest he came to resisting a direct order. The rehabilitation hallway light reflects off the floor and bothers men learning to walk with new prosthetics. Several administrators glance toward one another. The family room door closes too loudly. Walter nodded toward another wing. Some parents sleep there after midnight. He pointed toward the wheelchairs. Two of those breaks slip. Then toward the patient rooms. Room 12 wakes whenever the supply cart hits the floor seam. Room 9 asks for water, but usually wants someone to stay for 2 minutes. The corridor had become silent again. These were not heroic facts. No citation would be written for them. That made them harder to dismiss. Walter looked toward the memorial wall. And some names collect more dust than others because the morning crew starts at the bottom. Tyler tightened his grip on the cloth. Callahan looked at the hospital commander. The inspection schedule is changed. The commander straightened. Sir, we begin with the maintenance route. Several administrators looked uncomfortable. Callahan saw it. You cannot lead a hospital you only see when the floors are polished and the sun is up. Walter shook his head. Do not turn this into punishment. It is not punishment. Callahan looked toward Tyler. It is training. Tyler nodded. I want the first night. Callahan did not answer for Walter. Walter studied the young specialist. You arrive at 4:30. Yes. No pressed uniform. Tyler hesitated. What should I wear? Walter looked at the gray cart. Something you do not mind getting dirty. The following morning, Daniel Price came out of surgery in stable condition. The displaced fragment had been secured. The swelling had been relieved before permanent damage occurred. Walter finished his shift without visiting the recovery floor. He cleaned 2 rooms, checked the wheelchair brakes, and polished the memorial wall. When he reached Samuel Ward's name, his hand stopped. The tremor moved through the cloth. Walter placed his fingertips against the engraved letters. 20 men. 19 came home. The count had never changed. Footsteps approached behind him. Tyler wore a plain maintenance apron over civilian clothes. He had arrived 10 minutes early. Walter did not turn. Top row. Tyler looked up at the wall. Hundreds of names. He opened the cloth. Walter spoke again. Read before you wipe. Tyler began. Captain Michael Adams. He cleaned the first name. Sergeant First Class Henry Alvarez. The second. Walter remained beside Samuel Ward. Tyler worked downward slowly. For the first time, the wall was not a surface. It was a formation. Each name a person who could no longer answer. Several hours later, General Callahan returned without an inspection party. He found Walter near the recovery elevators, tightening a loose screw on a wheelchair footrest. You missed breakfast. Walter tested the footrest. I ate. Coffee is not breakfast. It is before 6. Callahan smiled. Daniel Price's wife stood behind the glass doors of the recovery unit. A young boy sat beside her holding a folded drawing. Walter noticed. That is family? Yes. Callahan looked toward Walter. Daniel asked who heard the problem. The captain's team treated him. That was not his question. Walter placed the tool in his pocket. Callahan lowered his voice. Why did you stay here after the army? Walter looked through the glass at the boy. For years, every room I entered waited for me to decide who still had time. He looked at the gray cart. I wanted work where no one had to wait for that decision. But you stayed close. Walter watched Daniel's son press the drawing against the glass. Close enough to hear. The recovery doors opened. Captain Mitchell stepped out. Sergeant Price is awake. Walter began pushing the cart away. Mitchell stopped him. He asked for you. Walter looked toward Callahan. The general raised both hands. I said nothing. Walter entered the recovery room. Daniel lay elevated beneath a white blanket. His color had returned. His wife sat beside him. Their son stood near the foot of the bed. Daniel looked at Walter's gray shirt. You are Mr. Hayes. Walter nodded. They said you noticed something. The captain confirmed it. Daniel held out his hand. Walter looked at it, then took it. The younger soldier's grip was weak but deliberate. Thank you. Walter glanced toward the boy. Go home when they let you. Daniel's eyes tightened. That is all. That is the assignment. Daniel smiled. Yes, sir. Walter started to release his hand. Daniel held on for 1 second longer. My son drew this. The boy lifted the paper. For figures stood beneath a large yellow sun. One wore a hospital gown. One wore a gray shirt and pushed a cart. Walter looked at the drawing. The boy pointed. That is you. Walter's hand trembled inside Daniel's grip. The room was quiet. Daniel noticed. My father's hands did that, Walter said. Shake. After he came home, Daniel looked at his own hands. Did it stop? No. Walter released his grip gently. He learned what to do with them. Walter left before the family could ask more. In the corridor, Callahan waited beside the memorial wall. Tyler had reached the third row. He read every name. Callahan looked toward Walter. They should know who you are. Walter followed Tyler's progress down the wall. They know where to find me. That is not the same thing. It is enough. Callahan looked at the badge on Walter's shirt. Walter Hayes. Environmental Services, no title. Walter shook his head. No ceremony? No training position? Walter gave him a look. Callahan smiled. I had to ask. Walter returned to the cart. Callahan stood beside him. You saved me. Walter adjusted a stack of folded cloths. I bought you time. You gave me 47 years. You used them. Callahan looked toward Daniel's family. A wife. 2 daughters. For grandchildren. Walter nodded. That is the thanks. The general's voice lowered. You still think about Ward. Walter looked at the engraved name. Every morning. You did everything you could. I know. Callahan waited. Walter's fingers tightened on the cart handle. Knowing does not make the room quieter. Callahan understood. He did not offer forgiveness Walter had not requested. He did not tell him to let go. He only stood beside him. After several seconds, Walter nodded toward Tyler. He missed a spot. Callahan looked. Tyler immediately corrected it. The general smiled. You always did notice everything. Walter began pushing the cart down the corridor. No, he looked toward Daniel's room. Only the things people stop listening for. Callahan watched him go. Officers and nurses moved through the hallway. No one came to attention. No one formed a line. They simply made room for the gray cart. Some greeted Walter by name. He answered each one. At the memorial wall, Tyler reached Samuel Ward. He read the engraving aloud. Medic First Class Samuel Ward. Walter stopped several yards away. Tyler looked toward him. Walter gave one small nod. Tyler cleaned the name carefully. The cloth moved once across the metal. Then again. No part of the inscription was skipped. Walter continued down the corridor. His hands still shook when the hospital became quiet. The salute had not erased the storm. Recognition had not returned the 20th man. But someone else had learned to read the names. A uniform may tell the world what a man does today. It cannot tell you every life his hands once held. And sometimes the person who saves a soldier is not the loudest voice in the room. Sometimes he is simply the one who stayed close enough to hear.